The myeloproliferative neoplasm space is becoming hot. That means new medications are being tested, new biological parameters that we found abnormal in myeloproliferative patients are being explored as a target for therapies. Now, it seems that finally we, at least in some patients, we are going to start talking about the targeted therapy that would target the malignant cells and not touch the normal cells. There is a lot of excitement about the possibility for patients with the calreticulin mutation, which is about 30% of the patients with myelofibrosis and about 30% of patients with essential thrombocythemia. There is a potential to develop new medications that would attack the patient's cells with those abnormal calreticulin proteins on their surface. It has to do with the biology. The calreticulin mutation, as is the case for MEPL mutation and JAK2 mutation, activate the JAK-STAT pathway, which is common in every single patient. Now, what happens, in fact, is that mutated calreticulin protein is excreted by the cell outside the cell and attaches itself to the receptor for MEPL, thrombopoietin receptor, on the surface of the cells. So the key word here is on the surface of the cells. That means it can be recognized by immune cells or medication specifically engineered to attach to the mutated calreticulin. This gives us a target, specific target for development of targeted therapies. And during the 2023, I hope to have evidence for this information to lead to opening a first few very exciting new trials with new medications that would specifically attack calreticulin mutated cells in the patients with one or the other of myeloproliferative neoplasms. Very exciting time indeed.